Good morning, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. Thank you for taking some time today. It is Wednesday. We're so happy that you could join us to be part of YWTV today. I'm so grateful to my guest today, Dr. Gloria Bachmann. We'll be talking about a very important issue and one that doesn't get the attention that it needs. So I'm so happy that we can put a spotlight on it today. And as always, YWTV is about educating and inspiring, our community. So I hope that you hear something today and it sticks with you and you share it into your circle in some way so we can spread the word about this important topic and this very important work that Dr. Bachmann is doing. The YWCA of Northern New Jersey is committed to empowering all women. And as many of you know from being part of our YWTV circle, we partnered with New Jersey Reentry Corporation recently and launched a circle of care group that's supporting women coming out of the correctional facility as they reentry into the community. And it's been we just finished our first cycle of the group. It was very powerful. We had a wonderful facilitator, clinician who worked alongside. I had the opportunity to sit in on a session as well. And we really were able to talk with these women about so many important issues to help them as they, reintegrate into the community. The work that Dr. Bachmann has been doing in this area is so important. And I was so grateful that, again, she could make some time so that we could showcase it. New Jersey Reentry Corporation launched their Journal of Women and Criminal Justice. This is a new effort and a very important effort, again, because it spotlights and puts attention to an area that normally does not get the focus that really is needed. We know that there are disparities in the healthcare for incarcerated women, not only during their confinement, but before that time and also afterwards. And it's really important that we highlight and make these issues public so that we can address them. And so again, I welcome Dr. Gloria Bachmann to join us today. She is the professor of Obstetrics and Gynecology, Associate Dean for Women's Health, and the director of the Women's Health Institute at Rutgers Robert Wood Johnson Medical School. She's here to help us not only understand about the inadequacies that this population of women face, but also ways that we can support systemic changes that are needed around our communities and around our country to help these women. Before we jump into the topic, I'd like to share a little bit about Dr. Bachmann's background. She is a national and internationally also recognized physician who has moved healthcare to the next level in many areas that include women's advocacy, menopause, perinatal issues, and obstetrical safety, sexual health, LGBTQ plus wellness, healthcare for incarcerated women, diversity and inclusion initiatives, One Health, and gynecological pain syndromes as well. She is Professor of Obstetrics and Gynecology, Associate Dean of Women's Health, and Director of Women's Health Institute at Rutgers Robert Wood Johnson, as I shared. And in addition, she is also the Medical Director of the Proud Gender Center of New Jersey and the Chair of the Health Committee of the New Jersey Women's Commission on Reentry Services. She is a very respected clinician, a valued mentor, a prolific researcher, and a sought-after educator. So we're so grateful that she can make some time to talk with us today. Welcome, Dr. Bachmann.
Well, actually, I'm so honored to be part of the YWTV program. And I actually want to start with asking all of our viewers, including you, a key question, because you brought up circle of care and how circle of care is such an important part of the reentry for women who have been incarcerated. And so my first question to everyone listening is, if you were incarcerated, let's say for 5 years due to anything that you could think of, shoplifting, etc., and then you are back in the community and you meet some old friends in town, and they say to you, Dr. Bachmann, where have you been the past 6 years? what would you say? What would you say to them?
Right? That's a tough question to
Right.
answer.
And what if I answered to you and I said, "Well, I've been in prison for these past years." What would you think of me? What would your first thoughts about me be if I answered that way?
Yeah. There's definitely
So
a stigma attached for sure.
right. So this is just one small hurdle, and it truly is one that not only affects the person who has been imprisoned, so that if Gloria Bachmann were in prison for the past 5 years and I had to tell my circle of friends who might not have known that I had been in prison, they're going to obviously start to question, well, what did I do and why did I do it and da 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 da. So that it really is a hurdle for me, but it's also a hurdle for my family.
Mm.
So that many of the women who are incarcerated either are pregnant when they're incarcerated, about 5%, or many of them have children at home. So it also affects the children. What do the children say when their mom is in prison and they're going to school and at a picnic or at a get together at school? Everyone says, well, why isn't your mom here? Where's your mom? What do the children say? And how do they say it? And how does it affect them and their social skills, their growth, etc.? So there's many aspects of what happens to everyone who's in prison, but especially women, because they many times are moms and have young children and families, and they're separated from their families, or they may actually give birth while
Mm.
they're in prison. And it's the stigma, as you said, which is one of the major hurdles that women do face when they have been incarcerated for a period of time. So education like this is so key for us to understand. How can we help? How
Mm.
what can we do to stop that stigma, to stop that negativity, and say, listen, and I say this to everyone, any one of us can make a mistake. Any one of us, myself included. And I could have been in prison for the past 5 years, 2 years, 10 years, etc. So it's not, no one's immune from anything in life. It's like no one's immune from health issues.
Yeah.
Any one of us could develop hypertension or a heart problem or diabetes. And that's true with prison, that we're not immune from doing something, making a mistake that lands us in prison. And for many women, they don't have the resources to even get a little team to help them through the
Yeah.
issues that, are putting them into a situation where they're either going to prison or they may go to prison. So that's one of the first things that we have to address is education of society and each and every one of us that we can end prison at one point. So if if I were asked after being in prison for 5 years, where was I? What do you think the best answer is? Well, there's two answers. The first answer is you can be very honest and say, I made a mistake and I was in prison. But another way of saying it is it's been an educational experience for me the past 5 years. I've been educated that I've made some mistakes and I've been in an educational program. Unfortunately, it's one that not one of us would want to have to endure.
Well, I appreciate you
And
giving us.
so it truly is a way to say something that I'm so so this is a way that one say that I've been rehabilitated. I'm back in my community. I'm reentry and I've been educated, and I'm going to use that education not only for myself and my family, but for everyone who I'm in contact with and who I work with and who I go to religious services with, for anybody. I think our first lesson in really understanding the issues of incarceration and our being accepting of it, and how can we ease the burden for women who have been imprisoned.
Yeah, I really appreciate that perspective, and reframing it for people, because I agree that
Another aspect that I'd like to talk about. Am
we're having a little issue with your transmission, Dr. Bachman. It's coming in and out, but let's keep trying to talk through it. Hopefully, it'll get a little steadier.
Okay.
But what I was saying though is I do appreciate the perspective that you're sharing, and
Okay.
and helping us reframe our thinking. The natural thinking, right, of the stigma attached to women in prison. One of the questions that I want to ask you is that we know that there are so many issues with our healthcare system, period. I mean, just, systemic, changes that are needed. We know that there's systemic racism just in our general healthcare system, embedded, that we're working through. And then, we have to look at the unique healthcare needs and the difference in the system for women who are incarcerated. Can you talk a little bit about that specific area, about women's health and some of the issues that women who are incarcerated or are reentering into the community are dealing with, and why they get overlooked and ignored? For those of you with us, I believe that
You bring up some very important aspects of incarceration.
I think we might be having some transmission issues for our viewers, but I know Dr. Bachman's trying to share a response. So we're gonna let's see if we can get it to come through.
Let me just address some of the health issues.
So for our viewers, I'm sorry, I think we're having some technical difficulties. As you can see, Dr. Bachman is at the hospital working and taking the time to be able to talk with us right now. Sometimes those the facilities there are challenging with Wi-Fi and being able to get a good line, out. So I think what we're going to do is stop the broadcast, and we'll come back and share this with you again at another time. Okay. Thanks everyone for your patience. This is such an important topic. We're not going to lose sight of bringing it to you. We're just going to work on. Oh, wait, maybe we can get her back. Let's see. Wait. The show must go on. Let's see. While we're getting Dr. Bachman back, or trying to get her back, I just want to make a note for those of you that are watching. The links in the comments are already there, so you can learn more about New Jersey Reentry Corporation, as well as the Journal of Women and Criminal Justice.
needs that
All right. I think unfortunately we're still having the technology issues on the other end there. So folks, sit tight. We're going to end the broadcast and we're going to come back to you and make sure that we bring this important information back to you shortly.